I'm Cheyenne, and I'm going to be your student nurse today. I'm going to go ahead and begin with providing some privacy and washing my hands, and then we'll get started. Okay, so I'm going to be performing a neuro assessment on you today, if that's all right. So I'm just going to ask you a few questions, and then I'm going to have a few things that I would like for you to do so that way I can just assess. Can you tell me your name and date of birth?
Audra Lee, 12/22/1999.
Okay, do you know where you are right now?
In the hospital.
Okay. Do you know what year it is?
2019.
Okay. And do you know what season it is?
Fall.
Okay, good. So I assessed the eye opening when I'm walking into the room, and it was spontaneous, so I'd rate that as a 4 for the Glasgow Coma scale. By the questions that were answered, patient is oriented to a 5. And so also walking into the room, I assessed the posture and position. Patient appears to be sitting comfortably. Her appearance is well, and she looks fine. How do you rate your pain?
I don't have any pain right now, so a 0.
Okay. So visually, the patient appears to be symmetrical. The patient appears to have proper skin integrity with everything intact, clean and well groomed. So I'm just going to take this pin light, and I'm going to have you, I'm going to just place my hand over your eye, and then I'm going to shine this pin light in it. If you can just keep looking straight, and I'm just going to assess your pupils, okay? And then if I can have you go ahead and look at this pin, and then you're going to look at the ceiling as well. And then back. Alright. And then can I have you follow my pin where it goes? Alrighty. Okay, so next I'm going to have you close your eyes, and then I've got this cotton ball, and I'm just going to touch you, and whenever you feel it touch you, just let me know that, like, okay, I felt it. Okay, so go ahead and close your eyes.
Okay. Okay. Okay.
Okay. And then also with your eyes closed, I'm going to take this cotton ball and then this tongue blade. And then whenever you feel one or the other touch you, let me know if it's soft as in the cotton ball or if it's hard as in the tongue blade. Okay, so if you can go ahead and close your eyes.
Soft. Hard. Soft. Hard.
Alright, great. Thank you. Okay. Can I have you go ahead and clench your jaw for me? And then you're just going to kind of move it to side as it's clenched. Alright, good. And by doing these things, I'm assessing the cranial nerve function just to ensure that everything's working properly. Can I go ahead and have you make some facial expressions? Can you smile for me? Okay, frown. Can you raise your eyebrows? Alright, great. Okay. And then right now we're just going to go ahead and test your balance, which we can do settings, so if you'll kind of just set up straight, and then if you'll close your eyes for me, and I'm just going to watch it for just a few seconds, okay? Alright. And then can I have you open your eyes, and we're going to just do the same thing? Okay, you can go ahead and sit back comfortably. Okay. Can I go ahead and have you swallow for me? Alright. And then can I have you open up your mouth, and I'm just going to take this tongue blade and I'm going to test your gag reflex, okay? Alright, thank you. Okay, can I go ahead and have you stick out your tongue for me, and I'm just going to have you move it side to side. Alright, great. And now I'm just going to assess if you can follow where my finger goes by taking your finger and touching mine whenever I move it.
Okay.
Okay. Okay, great. You're doing a good job. can I have you go ahead and lift up your hands, and then I'm just going to have you squeeze my fingers. Okay. And then if you can lay your hands like this, I'm going to push down and try to push up for me. Okay. And then can you push down? Great. I'm going to go ahead and do the same with your feet. So if I can have you push against my hands. Alright, and then can you press up? Good job. Sorry. Okay, so now I'm going to test your hearing. So I'm just going to click my fingers around and then just let me know when you can hear a sound.
Okay. 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 Okay.
Okay, great. Okay, and then now I'm just going to take a minute to go ahead and assess your memory. So can you tell me something that you did last week?
Studied for an exam.
Okay. And then do you remember where you went to preschool at?
Well, I didn't go to preschool.
Okay, do you,
So my mom
maybe
taught me.
kindergarten?
Yeah, Green City.
Okay, great. So that's going to go ahead and, well, actually, one more thing. I'm going to go ahead and assess a Babinski sign on you. So I'm going to take this tongue blade, and I'm going to go ahead and just run it up the bottom of your feet. So I'm just assessing for the movement of your toes. Now you're just going to feel it on your heel, and I'm going to run it up your foot.
Okay.
All right. I'm going to go ahead and do the other one.